Hello, everyone. This is Emmy Vadnais with the Holistic OT community. I'm also with Andrea Cordis. We are both OT practitioners, and I'm super excited because Andrea is visiting here in Minnesota, and we thought it'd be fun to pop on today and just talk a little bit about OT and integrative health. So, Andrea, can you share a little bit about your experiences or what you currently are doing and your background with OT and integrative health to our wonderful viewers and listeners?
Absolutely. So I started as a certified occupational therapy practitioner in 2003, and I was working in mostly geriatrics, kind of incorporating a lot of the yoga that I was doing in my own life into my practice, taking continuing ed, all that kind of stuff. Started doing Tai Chi, continuing education as well, and just incorporating that into my OT life. Then I want to say it was 2014, 2015, and I was working at a university, and we were starting a community-based, emerging practice kind of a setting where we were going to be working in the community with older adults and folks with dementia and healthy older adults as well. And we decided to kind of go with a more holistic OT approach, kind of incorporating those integrative health pieces. And I became certified in Reiki. I did more Tai Chi and yoga education. That's when I met you. And that was the coolest thing.
Yes. This is our first meeting in person, actually, from knowing each other for many years online. Yes. Yeah. And so you also have become trained in Reiki as well, and you teach yoga classes.
Reiki, I'm a yoga teacher. I am a Tai Chi instructor. Tai Chi exercise instructor is my official title.
Wow.
So I incorporate all of that into my OT life.
That's fantastic. And additionally, Andrea, also, you are I think the only or one of the few OTs I know who also brings in integrative health into a fieldwork setting for occupational therapy. So you are actually she's training the current and future OTs of the world in the benefits of integrative health. So what do you love the most about OT and integrative health, or how has it enhanced your life personally, and how do you see that it benefits the students you work with and your clients?
The integrative health practices that I do myself, it was great to learn them, to be able to teach other people and to teach my clients and to teach the students how to kind of utilize those in their practice and in their lives. But it's really helped my own life. Self-care, being able to kind of rely on my Tai Chi, my yoga, my meditation skills, like doing self-care with Reiki, things like that have helped my own life. But also I kind of teach those things to students. I think one of my favorite stories actually about students and integrative health practices, I had a student probably about 5 or 6 years ago. She was at one of our emerging practice settings where we were kind of doing all these community-based OT things and incorporating all of these holistic integrative health practices into them. And I did a Reiki session with each one of them.
Nice.
And she was like, oh, this is kind of woo-woo, weird, whatever. She recently reached out to me about a year ago. She reached out to me and she said, thank you so much for that. I never in a million years would have ever thought of that. She now owns a private practice where she is a Reiki master.
Oh, wow.
And she incorporates her Reiki skills and works in women's health in OT as a private practice OT.
That's fantastic. Yeah. So what are the ways that you feel OT and integrative health or using these holistic integrative health approaches have helped you personally in your life?
It has opened so many windows for me just to meet new people, to talk to new people, to open the eyes of clients and potential clients. I know we were talking earlier about a stroke support group that I work with, and they have really opened up they love Tai Chi, they love Reiki, they love learning about all sorts of integrative health practices and different ways to work on their own self-care. It's just nice to know that there's other things out there than the regular, straight up textbook style OT and medical model kind of things.
Yeah, there's more tools in your toolkit.
Yes.
And what has it done for you with your own self-care? Like, what are the benefits you've received?
I feel like I know what to do for myself a lot better when I teach it to someone else. I'm like, oh yeah, I remind myself often of what works well for me or what works well for my clients that can also work well for me.
And what exactly is that? Like, do you feel like you're calmer throughout the day?
Oh, absolutely.
You can respond.
I can handle
versus
things
react.
better. Yes, I definitely can handle things better. I can work through situations more clearly. I can anticipate things a little better and like know how to handle that situation just by taking a moment, being a little more mindful, things like that. Yeah, I just feel better in general.
Yeah, so it's really expanded for you and definitely for me as well, resources for our lives.
Absolutely.
That can help us in ways that we weren't otherwise being able to be helped. And for those listening who are wondering, or maybe looking for some encouragement or inspiration with OT and integrative health, what tips or suggestions do you have for our listeners as far as, because you've now have taught so many fieldwork students and you have networked with so many people and you know a lot of the strong benefits. What would you say to those who are not sure if maybe Reiki really can do anything, or Qigong or other forms of energy healing or yoga? What do you want to say to those folks?
I would honestly say try it yourself first. Like, have a Reiki session, take a yoga class, take a Tai Chi course. Do those things for yourself first. Yeah. See if you like them, see how you feel afterwards. That's and then advice. If it's something that feels good for you, it's probably going to feel good for someone else. And then you can further your education and your knowledge on those specific topics. Like, find something that really makes you feel good, because when we talk to our clients or our patients about one of these types of techniques, like, it's nice to have that personal experience to share with your client and say, I've done Reiki. I've had Reiki on me. I've had a yoga class where I feel so much better. I've practiced mindfulness. And so knowing that you can use that, it kind of helps with your therapeutic use of self, of being able to share that with your client.
Yeah. So it's like, how do you really know what an orange tastes like unless you actually eat the orange? And so once you have that experience, you can really get that felt sense, that experience, and then you can get education. I happen to know that you have a master's in education, and I essentially have a continuing education company on integrative health approaches for healthcare professionals. And I think you and I are probably big advocates of people then, once you find something that appeals to you, whether you're new on this journey or if you've been doing this for a while, to go ahead and take a continuing ed class.
Absolutely.
Yeah.
And, honestly, there's been, in the last few years, maybe in the last 10 years, I would say there's a lot more continuing ed on these types of integrative practices that, you don't have to worry about, like, is it approved? Is it going to give me continuing ed for my license or my certification? It absolutely will. There are so many courses out there. There's so many OTs that are out there practicing this good stuff.
Definitely.
They're teaching it as well.
Yeah, for sure. And some of them might be approved by certain organizations. I know for myself, I'm in the third-party educator camp, but that's how I received a lot of my training in these approaches. And I was able to get recertified and get my relicensing going. And I've been an OT since 96. And so you can definitely use that. Just look at what your criteria are in your state or your local governance of what is needed for your relicensing and so forth. So, well, any other thoughts you have about OT integrative health, or what's next for you in your journey with this, since you've already done so much? And I'm so glad to talk with you because I know you're a big proponent of all of this.
Yes, the future is always open. I would say that even if you feel like you can't do it in your type of setting, like you're in a medical model. I work per diem in inpatient rehab, total medical model. I use these practices all the time with my clients and my patients, and they benefit from it. So it doesn't matter what practice setting you're in, you can always find some way to incorporate it. It doesn't just have to be a private practice. It can be any kind of setting, to be honest.
Right. As long as it's appropriate to the plan of care and the person you're working with across the whole lifespan.
Working towards their goals, and it will help.
Yeah, and I have found that for myself, too, that I experienced burnout early on in my career, and these integrative health approaches really helped with that healing and recovery. And so the integrative health approaches not only can help in a rehab setting, acute, whatever age a person might be, but it also can help with health, wellness, and prevention, which I think we're all seeing a lot of change, and many of you are a part of this, and we thank you for that, for being leaders in healthcare to help move toward that prevention and wellness model, because we know that so much can be prevented these days. And of course, some things might still happen for people, but we want to help before people, start losing their ability to function and so forth. So
and to stay well.
Yeah. Absolutely. Well, thank you so much for being with me, Andrea. And for those of you also being with us, we're so glad you're here, and we wish you well.
Thank you.
Thank you. Bye for now.